So, welcome everybody to this virtual congress organized by the British Society of Gynecological Endoscopy. So, I'm Dr. Bigatti. I'm presently based in Shanghai, where I am the director of the Sino-European Life Expert Center. So, the title of my presentation is Why We Should Choose the Shaver Technique Today. So the idea of the shaver came many years ago when I saw a live perforation during a workshop, which was not a virtual congress, a virtual workshop, but was a real workshop organized in Bonn, and they had a very bad live perforation during a live procedure. So since then, I start thinking why we should not find an alternative method to do operative hysteroscopy, which should be easy for the surgeon, fast also in terms of time of the procedure, and much safer of the patient. So this was the reason why I start thinking about making an alternative device, which is the present shaver. And also it's the shaver, like it has been designed today, it minimize trauma and should be the best choice for infertility patient. And in the end, we personally think that is also a convenient device. So the reason why is the shaver is easy to be used by the surgeon is and also fast is because the crucial point is that tissue chips are removed at the same time as you resect them, and this also is very important because you not only keep the visualization, but you always have the control of the operation, so you always see what you are doing. This is the crucial point, because by removing the tissue chips, you always make your surgical field better. You don't get any collapse of the uterine cavity, so it's totally different. You have no tissue chips floating around and which impair your visibility. Another important thing is that you have no in and out movements, and you know that by doing these in and out movements, which you normally do with resection, you probably bring air inside the cavity. So air embolism is probably, we don't know actually right now, which is actually the reason of air embolism, but probably also we should not underestimate these in and out movements which you do with the resection. With the shaver, you go inside the cavity, you place your device, you start acting the device, and you finish the procedure without going out of the uterine cavity. And additionally, with the introduction of the 19 French shaver, there is no need in most of the cases of dilatation. So this video, which is a video of a polypectomy, shows you all these features of the shaver. So you see that you get a large polyp based on the posterior wall. You go inside the cavity with the blade. You first check that the blade is working under vision. Then you place the blade on the top of the polyp and you start the procedure. So you see the blade is working for you. You don't have to move. You just keep the position, and in short time you remove completely the polyp. So when we are talking about polyps, we always speak about seconds. So in most of the cases, the dilatation in case of the 24 French shaver is much longer than the procedure itself. You see that you can easily work very close to the tubal ossia without being afraid to make any damage. You always have the control of the situation because you see the cavity, there is no collapse of the cavity, and also the bleeding is in most of the cases acceptable. So why the shaver is a safe device? First of all, because it's a mechanical resection, so electricity is not involved. So if you think when you have the receptoscope blade inside the uterine cavity is one of the most dangerous procedure we have, because electricity and heating, it makes it very easy, if you don't see well, to make a perforation. And if you have a mechanical perforation, of course it's always a problem, but is much I mean the damage that you create is less than you can do with electricity. Additionally, you have no air bubbles which are induced by resection. You know, bipolar receptoscope creates a lot of bubbles, while the shaver, because it's completely mechanical, does not induce any kind of bubble. So the problem of bubbles is another big problem regarding air embolism, because actually you don't know which are the bubbles. You cannot differentiate between bubbles created by resection, by the bipolar receptoscope, from the bubbles which are coming from the fluid bag. So if you see bubbles inside the cavity when you are using the shaver, you are sure that these bubbles are coming from the bag, and so you can immediately aspirate these bubbles. Additionally, within the 19 French shaver, which has a diameter of only 6.3 millimeter, doesn't need any kind of anesthesia in the majority of the cases, or at least you can do a mild anesthesia, which is some local anesthesia. What is really important about the shaver, that in the majority of the pathology, which are about 90% of the cases, the resection is really very fast. By being fast, you reduce all the anesthesiological complication regarding fluid deficit, or even regarding any kind of reaction to the anesthesiology by not doing any anesthesiology. So this is a very interesting case we did in Shanghai. It's a case of placenta remnants which were based completely in the cervical canal. This patient did a C-section 3 months before for a cervical pregnancy, and you see all the remainings are based actually placed actually in the cervix. So you see, you go inside with the blade, you start eating all these remnants. In this case, the bleeding is really little, because from the time of the original procedure there has been a period of almost 3 months, so the remnants are almost devascularized. You see that you go inside the uterine cavity, and the uterine cavity is completely free of placenta remnants. The cavity is completely normal. So we worked all the time into the cervix. So you know, if you use the receptoscope in the cervical canal, how difficult it can be. So I'm talking about the 22 and the 26 French receptoscope. So you see, in this case, this was the niche where all the placenta remnants were based, and you can still see some stitches of the previous C-section, which means that we were able to work very close to the scar of the previous C-section without making any damage. So this is the amount of tissue which has been removed. Of course, when you deal with placenta remnants, you always have to be very careful and use the ultrasound guidance in case of bleeding. But this is just to show you all the potential of the shaver technique. So you see, this is our numbers, and since I started using the shaver in 2009 until I am based in Shanghai, we did more than 2,000 operations with the shaver. The majority of the cases are polyps. You see that the polyps are about 81 polyps and benign pathology, which includes also hyperplasia. They are about 81% of our work. So the other indication are about 7%. So you which means that almost 90% of the cases can be done in a single step procedure without any problem with the shaver. Myomas are about 13% of all our cases done with the shaver. Of this 13%, at least 50% of the myoma could be done with the shaver in a first step procedure, and very well done. So it means that almost 95% of the cases can be approached successfully with the shaver. So that's why we think that the shaver should be the instrument of first choice in case of endometrial pathology, because you can do the majority of the cases in a very safe way, and I should leave only the rest to resection. So this means that we shouldn't abandon bipolar receptoscope, but of course we should limit its use, because the shaver is much safer. So according to our report of 4 months of work in Shanghai, because we opened the center in August, you see we did about 828 cases with purely diagnostic hysteroscopy without anesthesia. So which includes some office procedures, so small polyps that could be treated with the trophyscope, and 660 procedure with the shaver technique. And you see that during this period we did only one resection on adenomyosis. So you see that in 4 months of activity we really reduce the use of the resectoscope, and most of the cases we were able to use the shaver. So this is another chart which shows you that since we started, we have increased the number of diagnostic, and of course as a consequence of operative hysteroscopy. So another important feature of the shaver is that the shaver minimizes trauma, so it should be the best choice for infertility patients. So when you use the shaver, you have no thermal injury, so you do not touch the healthy endometrium. So you work only where the damage is, and also because you can work very close to the tubal ostia, you are not afraid to make any damage to the tubal ostia, and so to impair the fertility of the patient. But the real big advantage of mechanical resection of intrauterine pathology is that probably we are building less surgical adhesion, so de novo adhesion formation, and this is why we think that especially for infertility patients, the shaver should be chosen as a first choice procedure. How we do prevent adhesion? So we know that there are 2 ways to prevent adhesion. The first is to minimize trauma. These are, let's say, principles which are coming from microsurgery. So if you minimize trauma, so if you reduce the number of DNC and you increase the medical management of abortions and miscarriages, you probably, in total, reduce the mechanical trauma of the endometrium. Additionally, you should also reduce the thermal damage which you have with resection at operative hysteroscopy. So whenever you do a coagulation, whenever you use electricity, you leave an ischemic stimuli inside the uterine cavities, and this ischemia is reduce the fibrinolytic system, so fibrin stays inside the uterine cavity and acts like a glue between the wall of the uterus. So this is the reason why you get adhesions inside the uterine cavity. So another important thing is, of course, to keep the wall of the uterus separate, but you should also increase endometrial regeneration. So if the endometrium heals in a very fast way, then you do not give the time to the wall to attach together. So if you let's say can increase the fibrinolytic system, so you remove the fibrin inside the area where you make your operation, then of course you give the time to the endometrium to heal, and so you will not have adhesion. So you see how you can increase endometrial regeneration. You can increase by increasing the neoangiogenic effect inside the lesions. You increase the fibroblastic differentiation, which are the fibroblasts are remaking the normal tissue, and you keep the walls separate. So by doing this, you will get this reduced adhesion formation. So minimize trauma, we think that the shaver is going in this direction because when you, of course, use mechanical energy, of course, you do not leave any ischemic stimulus, persistent ischemic stimulus inside the uterus. This is the same inside the peritoneum, but it's the same inside the uterus. So by mechanical resection, you probably reduce the damage that you do to the healthy endometrium. Of course, in addition, with the shaver, you really work where the damage is. You don't make actually a damage of the rest of the endometrium, especially when you are dealing with myomas, for instance. How you can increase endometrial regeneration? So there has been an attempt to use IUD and Foley catheter inside the uterine wall to keep the wall separate, but anyway, this is always a foreign body, so that was the only solution you had until now. Since I am in China, I started to use this gel because actually this is a Chinese company, is a Mataregen gel, and is produced by Bioregion. And this gel is a very, it's very dense. So the degradation is quite long. It takes 14 days to be removed. And of course, this gel has additionally, I mean, the fact that the gel stays inside the uterine cavity for 14 days keeps the wall separate. Additionally, you can modulate the inflammatory response and increasing, of course, neoangiogenesis and also fibroblast differentiation. And so you facilitate the scar-free tissue repair. So this is, I think, is the most physiological device we have at the moment. Last, this is also quite important today, is that the shaver technique is also convenient. Why is convenient? First of all, because the IBS is completely reusable. So the initial cost will be soon returned. So of course, the expense in the beginning is high, but in terms of after a few operations, you get it back. And additionally, the optical system has two advantages. The first is of very, very high quality, so the images that you get are really excellent. And second, it's a very strong device. You know that the receptoscope are quite delicate. It's very easy to break the loop, of course, but also to break the device itself is quite fragile. On the other hand, the shaver is much more simple because you have an optical system which is already, you don't need to assembly, and the only thing you have to prepare is the blade. You just have to click in the blade inside the endo. The setup of the shaver actually is a little bit more complicated because on one side you have the let's say the optical system, which you can compare to the receptoscope, where you have an inflow and an outflow, especially with the 24 French shaver. With the 19 French optics, you just have an inflow. And on the other side, you have the shaver, where you have you must prepare an additional pump, which is the Endomatel C, connected to another engine. So you have to have these two units, and you have to connect the handle with these two units. So let's say that after 2-3 times that they do the setup, the nurses actually prefer to use the shaver than receptoscope, because in the end it is much easy. So this is a video which was made in Shanghai, which I want to show you.
Center at
so I will quit.
He's the first foreign doctor with a full-time job at a state-owned hospital. Reporter Zhang Yue tells us more about the Italian.
The intrauterine Bugatti shaver, or IBS, is a tool doctors use to examine and treat the inside of the uterus. It's acknowledged as the safest and most precise instrument in the field of hysteroscopy, and was invented by 58-year-old Italian doctor Giuseppe Bugatti. Bugatti works as the director of the Sino-European Life Expert Center at Renji Hospital, focusing on intrauterine diseases, which are common among women between 40 and 50 years old.
And you're always afraid, you try to keep the pressure down.
This technique is very good for patients who are
searching for kids. All operations here are done on a day surgery base. Not an operation, no anesthesia, nothing. For the operation, they come in the morning and they leave by 12 o'clock.
In late January, when the COVID-19 outbreak emerged, the Italian refused to abandon his patients and return home. In February and March, the center had to shut down temporarily to reduce cross-infections. Only emergency surgeries were permitted. This is the order. Bigatti volunteered to join the fight against COVID-19 in Wuhan, but his offer was refused because there was no demand for medical workers specializing in gynecology and obstetrics. So Bigatti made full use of the time to prepare the new center, which opened last August.
We had all the time to prepare the center, the building of the center, and also the training of my doctors.
With more advanced instruments and updated equipment, the center is doubling the number of surgeries.
We plan to do at least 20 diagnostics per day, which means 40 operations per day, which is 200 per week.
Bigatti says China has advantages for research in intrauterine diseases, thanks to patient numbers based on its population. However, the center's aim is not about the quantity of work, but the quality.
We are fast, we are very precise, we give quality to the operation, especially for patients, for infertile patients.
Bigatti and his wife have been living in Shanghai for almost 2 years. And what Bigatti loves most is traveling in China.
We've been to Shenyang, Shenzhen, and also to Shijiazhuang. Another place very interesting is Harbin. And also to Tianjin, because Tianjin, which I miss right now, is somewhere here. And Tianjin, because there is a part of Tianjin with a lot of Italian remainings. Some Italian soldiers were in Tianjin until 1945, until the end of the Second World War. Then they have to leave. Concessione, it's called Concessione in Italian. Another place which I would like to go is to Urumqi.
But as Shanghai has become their second home, the couple do not feel homesick.
Shanghai is the most beautiful city also in China. I really feel at home. It's a strange sensation, but it's true.
I should say that the pizza that you have in Shanghai is much better than the pizza that we have in Milan. This for sure. You can live the Chinese way or the Western style. We like the Chinese style, but we also like our style. So we have the possibility to do the same things that we do in Italy. This is for you after.
Bigatti, who originally only planned to work in Shanghai for 2 years, is considering renewing his contract for another 2 years. He says he hopes the pandemic ends soon so that he and his wife can fly back to Italy to visit their aging mothers. Zhang Yue, Shanghai Live.
So, thank you very much for your attention. I hope that I was able to give you some information regarding the advantage of using the shaver. I know that my colleague from Iran, Sherazad Ansari, will also speak about the shaver and give you some more information regarding the clinical indications and also some technical issues of the shaver. So I would like to thank also Dr. Carolina Afors for this kind invitation. And I hope you will have a very nice meeting. At the end of my presentation, I always thank my friend Rudy Campo from Leuven, with whom I share the same concept of hysteroscopy. There are 3 centers which actually share the same ideas. Is my center in Shanghai, Rudy's center in Belgium, and also Ursula Catena in Rome. So there are 3 centers who has the same concept. Also, I like to remember also my friend Ivan Belle, whose genius in hysteroscopy will stay forever, and all members of a group of people called the Rollable Team, with whom we organized many international workshops around Europe many years ago. So thank you again for your attention. I hope you have a nice meeting. Bye.